Hello, everyone. Thank you for joining for this session. Before we begin, there are some housekeeping announcements that I would like to make. We'll keep the session as interactive as possible, so feel free to use the Q&A chat feature that we have at the bottom of the panel. The session will also be recorded. You can choose to also select the language that you would want to, that you are comfortable with. We have our interpreters who will be translating in English as well as French. My name is Sarvesh Tiwari. I work as the Senior Project Manager at Dimagi. For those who do not know about Dimagi, we are a social enterprise that supports governments and non-profits to maximize the impact of their frontline workers with digital solutions for data collection and service delivery. I will be moderating the discussion today. I am joined by a wonderful set of panelists. Before I introduce the panelists, let me take a moment to set the context as to what we will be discussing in the session today. We know that there has been a lot of investment increase in digital health tools, and specifically there is this market intelligence firm CV Insight, which came up with a year-end report recently, which talked about how the investment has increased to 70% to $57.2 billion in funding in 2020. A lot of this investment goes into building systems, which after a few years of use are either discarded or become obsolete, or they are replaced by a different system. So in the next 1 hour, what we'll try to do is we'll try to understand from our panelists how they think about sustainability of ICT4D systems, what are the key challenges that they have encountered in their programs, and how they addressed those challenges. So first we have Lakshmi Balachandran. Lakshmi is a Senior Director of Digital Health at the Clinton Health Access Initiative. She manages CHAI's digital health work across 35 plus countries, working with ministries of health to design, develop, implement, and transition technology systems for their public health objectives. Lakshmi's role oversees the digitization of disease surveillance systems, large-scale public health interventions, including immunizations, bed net distribution and mass drug administrations, supply chain and inventory management systems, health insurance systems, and other technology solutions foundational to our country's health system. Welcome, Lakshmi. Next, we have Poppy. Poppy Farrow is a senior digital health specialist with 10 years experience in low resource settings. She has been working across the digital nexus from design, implementation, and capacity building at multi-levels of routine and public health campaign tools, with a special interest in integration of public health facing solutions for stronger health system strengthening. Welcome, Poppy. Next, we have Maganizo Munawe. Maganizo is a senior digital health technical advisor to the government of Malawi. He has been working with the Ministry of Health in Malawi for 10 years, supporting the government in policy, strategy, and implementation of several digital health systems. Thank you all for joining. Let's start with you, Lakshmi. You work with several governments across different geographies. Can you give us a brief overview of your work and share some of the main bottlenecks that you have observed that affect sustainability of ICT systems?
Sure, thanks, Sarvesh, and thank you for the opportunity to participate in this discussion. So I can give a bit of an overview of the work that we've done in malaria, given that's what the conference is about, but I think a lot of the discussion and the lessons definitely apply beyond malaria as well. But within malaria, I think we work with national malaria programs in about 20 plus countries on their disease surveillance systems, as well as digitization of campaigns like bed net distribution campaigns, insecticide spray campaigns, as well as working on stock management systems, et cetera, and essentially digital health within those domains. We've, I think, worked on this over the last 5 to 7 years, and increasingly over the last couple of years, particularly, have been thinking about sustainability as Chai steps away from some of these implementations. They've become national scale systems in a lot of countries, institutionalized within the sort of national tech architecture. And now the question is the sustainability of those systems as we move away from the implementations themselves. And I think just thinking about sort of prepping for this conference itself, for this panel, we've thought about sustainability in a few different ways. There's the financial sustainability, which is essentially making sure the technology is viable and stays up to date. That can be the core. If there's an open source global good being used, then that's the core product itself, whether that's something like DHIS2 or ComCare or OpenSRP, Reveal, and things like that. But then there's also the aspect of the country-specific updates to forms, updates to dashboards, et cetera, requiring some level of funding and some level of sort of skills, staff, et cetera, to manage and maintain it. So there's the financial sustainability. This might include purchasing, maintaining hardware like tablets and smartphones and laptops and things like that. I think importantly, there's also the sustainability from management and maintenance of these systems. Oftentimes, it's departments of information systems or departments of IT within ministries of health who are tasked with managing and maintaining these systems. These are strong teams, but very, very small teams typically who are managing all of the country's HMIS systems, as well as the disease-specific, program-specific systems, as well as ad hoc pilots and things like that that come up. And so that's where we see a lot of bottlenecks as well, is just the number of staff available to work on the management and maintenance of these systems, to be able to upgrade the systems or make small changes or even large changes and additions to these systems. And then there's the day-to-day use of the systems itself, depending on who's using these systems, but typically anywhere from community health workers to health facility staff to subnational program managers and national program managers, making sure that it becomes a day-to-day part of what they do and their responsibilities. And that becomes sort of a key part of how that system is sustained and institutionalized, that it's used well, whether it's for data reporting or whether it's to just make operational workflows easier.
Thank you, Lakshmi. I do have follow-up question, but I want to wait for a little bit and bring in Poppy to talk about her work with the Malaria Consortium. I know, Poppy, we have chatted about the Upscale project in Mozambique, and I know how it started as an idea, and then you scaled it to a national scale system. So maybe can you start by giving us a brief overview of your work and share experiences of scaling the Upscale project within the country? And I'm also specifically curious to hear if the challenges that Lakshmi outlined, is that something that you have also faced, or are there different kind of challenges that you've faced while scaling it up? And I know you want me to...
Yeah, there's a few slides, yeah, just so that I can show the audience the sort of journey. So just to backtrack a little bit, so I've been with Malaria Consortium for 18 months as a senior digital health specialist. So I sort of adopted this program at a very midpoint. So Malaria Consortium implemented in 2016 an ICCM digitized pilot in Mozambique, which began using a cohort of about 1,000 community health workers who are known locally in Mozambique as APE. And so this sort of kicked off the digitization process of this community health project. So what started off as is specifically ICCM, and now currently has really transformed over those years. So this really is the journey. So it was beginning as this decision support tool, and it's now, just sort of galvanized over time. So as I say, it's a tool that was designed to support and guide community health workers through a series of pre-configured pathways to support the assessment and diagnosis of illness in children under 5, using just 1,000 CHWs as a cohort. Now, if we fast forward to today, we've now scaled it across to 3,500 digitized users. We have about 400 supervisors and just over 3,000 community health workers. Now, in terms of environmental coverage, that's coming from, we're working now in 7 out of 10 provinces in Mozambique, and we've captured around almost 1 million households have undergone that service delivery through upscale. The ambition with the ministry at the moment is to try and digitize 8,000 APAs at the moment by 2024. So yeah, really that is the sort of journey. If you could just move to the next slide, Savesh. So these were really the sort of primary objectives of upscale, and those do remain as they are. So it was developed to improve the quality and the coverage of health services at the community level by really addressing the 3 key community health worker program challenges at that time, which were primarily centered around this poor adherence to clinical guidelines, insufficient supply of commodities at the community level, and a lack of access of community health information. And this has really sort of transpired and filtered down to these 3 core objectives. So improving the case management, the health education, and those follow-up of patients who are referred to facility using this decision support tool on the device, which has digitized the entire CHW curriculum from the Ministry of Health. The second component is we've built out a really comprehensive supervision module within that eCHIS platform, which is really what it's become. So that step away from solely targeting ICCM to really becoming that CHIS. So it's really robust, it's incredibly broad. With the supervision tool, we've also built out a very comprehensive stock management where we have automated reconciliation of drugs, of commodities that are being issued out at the community level. And those supervisors are using a tablet form whereby the CHW is using a mobile device. And then it's really looking at that sort of data quality. We were trying to really improve on that particular piece. Next slide, please. So again, this is just really looking, this is an infographic in terms of the sort of content that we have. And again, that sort of broader expansion that also includes ANC, PNC. We cover a malnutrition module and the nutrition element. We're doing a lot of newborn screening. And we've also recently, as up until last year, added and expanded on a first aid module and COVID-19 screening and an ECD module. Now these, we'll talk about this a bit later, but these sort of requirements and this expansion has come really from either a donor request or from a Ministry of Health or through other partners who are becoming involved in upscale. So it really has grown over that 5-year journey. Next slide, please. And this again is just really sort of showing like the detail. It is a beast of a community health information system. So these are the different types of cases. We've got 18 modules, so it really is big. And I think there's positives in that expansion and there's also negatives, which I'll touch on a bit later on, but really that's the sort of, more of the detail. And then if we just go quickly over to the reporting, as it currently stands, all of the data that's coming from these 3,500 users is run on a Comcare server, and then we also have a separate DHIS2 instance with indicators decided obviously by Ministry of what they want to visualize. These are available on monthly reports, but the data does sit currently not in HMIS, and I'll talk about that later on in terms of how that does impact sustainability in our kind of plans in order to overcome that. So I think that's the last slide, so I'll just pause there.
I was saying that, as you said, that this is a massive system and it does touch upon very different areas and different kind of challenges that you talked about. What I want to do is I want to bring in Maganizo here, specifically for 2 points that were mentioned. One is something that Lakshmi mentioned a little while ago about the challenges in with a small team handling multiple different systems. And you have been, Maganizo, working with the Ministry of Health in Malawi for many years, and you have seen a lot of technological changes. Can you maybe shed some light on how the government handled this capacity challenge, especially given the fact that a small team has to handle multiple IT systems, upskill in a short time, and then kind of go running with it?
Sorry, hang on. Who's the question to? Maganizo.
The question is from Maganizo. Yes.
Okay.
Yeah, thanks, Savish, and everyone on the call this evening. Yes, I have been working with the Minister of Health, coordinating implementation of systems, the policies and strategies. Working with the Minister on one hand, and also working with implementing partners and the donors on the other hand. And yeah, it is a challenge. Ministers of health, mostly in the countries like Malawi, pretty much under-resourced, both financially, human resources, and with a lot of work to implement national systems. So I think it's one of the key challenges. As a small system, as a small team, implementing a platform is a project on its own. You need coordination. You need a technical team, the programmers, and also the deployment team. So everyone working together. So being small, for you to split in those functions, it takes a lot of your time. And the implementing a system is not just deploying it and showing people that this is the system. You have to take the people, the end users, through a transition process, more of a change management. So once you start deploying a system, it may take 1, 2, or 3 years before that system is adopted by everyone nationally. So that is just a single system. So if you start multiplying that by multiple systems, it means you are extending the little resources that you have to implement, and the consequences are big. You end up with multiple systems that are not properly coordinated, and also because you don't have time to do change management, to transition end users, you end up with a situation where maybe the adoption is not that good as you would expect. And also, deploying a system means you need to have a proper channel as part of the change management to support the end users. So the more system you deploy, the more work you generate, the more problems. So I think these are some of the issues that affect the sustainability of systems, especially if we rely on small teams to deploy multiple systems. So I was saying, working with the government on one hand and working with partners on the other hand, I think looking at a scenario like this, I think one of the key bottlenecks for sustainability is the harmonization. I think to get to a point where we are all building only maybe one or two or fewer solutions, but that can address a health-wide approach for digital services. So I think that's a key bottleneck to harmonize, to get into common investment, because once you get there, it means instead of duplicating, you can actually expand the small teams that are available in government to support with that. And also, I think the approach of getting into multiple systems, it also reduces the ownership that the government can have. I think my experience is the ownership in these platforms or digital solutions makes a bigger contribution towards sustainability. Most governments have little resource financial muscle, so they tend to be happy to invest or to rally more donors around a solution that government has accepted and has seen that it has more benefits if it is scaled to the rest of the end users. So maybe for now I can stop there, but the issue of under resource of the HR in the health ministries, I think is a big issue and the bottleneck towards the sustainability, especially where harmonization is not pursued. Yeah.
Thank you, Maganizo. And Maganizo, I think there are some some people are complaining that the mic had some background disturbance. So I'll summarize in few points what he said. Basically, he was talking about the ownership challenges within the government and bringing everyone together to kind of harmonize, which is a key element to sustaining these ICT4D systems. At this point, Lakshmi, I'll want to circle back to you and ask you this question, because I know you said you work with 20 plus governments and in different ways. I'm sure it takes a lot of effort in bringing everyone onto the same page, getting everyone aligned, all the different conflicting priorities getting aligned. So how do you and your team handle this challenge about ownership, and specifically with harmonizing everything and then kind of transferring it to the government?
No, I completely agree that that harmonization process takes a long time and it's important. I think we've worked with Malaria Consortium and Poppy's team in Mozambique around creating a malaria data repository there. And that process itself, I want to say, has taken, I think, at least 3 or 4 years at this point. And the first year or so was essentially just spent in having working groups of the right people from the ministry, as well as the various partners and stakeholders working within malaria, but within sort of the sub-themes of malaria. So those who are working on malaria stock, or those who are working on vector control, or those who are working on surveillance and entomology, and having different sort of technical working group discussions on what do we need this system to look like, what indicators do you want to be, what decisions will you be making, what indicators do you need to have in order to make those decisions, what data needs to be collected, and then how do we streamline all of the systems that exist for that data collection at this point. So that process takes a long time, and I think we try our best to do it upfront. And bringing together anyone both from the ministry side as well as stakeholders in the same room to have those discussions. But I think it also becomes a challenge to balance that against building momentum and showing progress on the digitization aspects as well, right? Because people don't want to be discussing and making decisions, but they also want to see the information systems being implemented, etc. So I also feel a balancing act of trying to have a few quick wins and build some momentum and engagement that then helps to bring together stakeholders behind a single vision as well.
Thank you, Lakshmi. Lakshmi mentioned about Mozambique and the upscale Poppy. So, and you had also in the initial deck talked about how you added different modules and different functionalities because they came up because of the requirement from a funder or some other requirement. So can you maybe also, I'm actually curious to hear, were all the modules added because the program kept getting bigger and bigger over the years, or it was more in terms of kind of trying to fit into all the priorities that we have in terms of everyone who is involved there, but also at the same time, making sure that the system remains impactful and continues to do what it is meant to be doing.
Yeah, I think this is where it can get difficult, and this is where coordination and governance is really essential. So, you know, these additional modularities that have been added, I think, is because, you know, we've had a champion within the MOH for upscale, which I think is a key driver for sustainability. And you're having to sort of manage all this other partner engagement. So I think by having a champion, you know, that sort of propels a digital platform into the sphere. It's like an advocacy, it's able to expose it more. So partners kind of started to hear more about upscale through that sort of more government ownership model that we've tried to adopt, which also does pose challenges. And so I think it's a fine balance of being an implementing partner, but also trying to advise at what point do you need to stop adding on to a platform before it can become too clunky and not streamlined enough. And I think it's managing expectations, and that's a day-to-day challenge for upscale. The partner space can be quite crowded, and there is demand, as I say, coming from a donor side, coming from a ministry side, and coming from other implementing partners who want to leverage on that existing, you know, ecosystem that we've created with upscale. So, and again, by adding on to a platform, I think, you know, the question is, does that still align with government national strategy? You know, does that tool still, is it still fit for purpose? Is it still aligning? You know, for example, because it's got so big, one of the challenges that we're now looking at doing is really shifting all of that data into HMIS. And the question is, does the current government server, if we were to move to a local hosting model, which is what we're trying to do in the next funding cycle, is that server infrastructure adequate enough? Now, it may have been 3 years ago, but with these additional modules and this huge repository of data that's being added to, there are questions around that sort of capability within the ministry. So as it grows, does the infrastructure required to operationalize it and to house it somewhere also fit its requirement?
Absolutely, yeah. And I think that remains one of the key challenges when we think about sustainability. Even in Dimagi, when we think about these systems that we deploy and then we scale it to national scale, that one aspect remains always a challenge, that are we designing it too complex to trying to do too many things. I want to go back to one point that Lakshmi made at the start, and then ask my question to Makanizo. But before that, if anyone has any questions in the audience, feel free to use the Q&A chat. Just a reminder, and also just a housekeeping note that Lakshmi will have to drop a little earlier, probably 10 minutes before this session ends. So if you have any questions for her, we can prioritize answering that. So Makanizo, my question to you is, often when we switch from one system to another, either we keep adding functionalities, as Poppy has mentioned, or we find a better updated technology and we would want to bring that into it. There are a lot of cost involved, and Lakshmi also touched upon the funding related risk and the cost involved, and the sustainability which comes into question around that. So when we switch from one system to another, there is a training cost. There could be, Poppy mentioned about server hosting. So hosting is one thing which a lot of governments are pushing for. What has been in your experience, biggest challenge with these frequently changing systems and updating technologies? And how do you kind of, from the government side, handle these frequently changing systems?
So thank you for the question. I hope now you can hear me. I was saying change is good. Sometimes it exposes us to new developments and the new ways of doing things in a better way. But also change has its own bottlenecks, which we need to manage, especially when we are doing this frequently. So when you introduce a system, there's a group of people at the back end, maybe the policy and the technocrats So you are on one hand, but also you have end users on the other hand. And I think in introducing a system, you want it to achieve the objectives. And usually the best way that to happen is for the end users to accept the change. Sometimes frequent changes, they bring in instability and lack of confidence in the systems from the end users. As you know, when you introduce a system, rarely does it go smoothly. Usually you have things to sort out before everyone can take off completely off the ground. So I think one of the key challenges in these frequent changes is to maintain the confidence of the users, to build their skills. The factor of resistance to change sometimes is just the phobia to start a new thing. And sometimes you lose some of your end users. They prefer to use the old systems rather than the new one. So I think that is a key factor. I know of a situation in Malawi where we changed from an old system to a new system, but the old system was still accessible to the users. And most of them would prefer to use the old one for their own reasons. I think they got used to how that system was working rather than to how the new system was working. So I think those are issues with changes. Apart from the costs, for example, for capacity building and the like, but also from the when you change, you're not dealing with the of course, you need to change the skills. You need to upgrade the skills of your technical staff. You need to upgrade sometimes even the infrastructure, sometimes even the devices that the end users have. They need to be updated so that they can conform with the new systems. So I think those are some of the things. But as I said, change is not is sometimes good. So it means also if you bring in better management and coordination for the change, it can also take you to better way of delivering health services. Yeah, so maybe that's what I can say on that.
That is very helpful to hear, because around phobia that you mentioned, which talks about user adoption, and even when we are switching from one system to another, one tool to another, or using one service and then they release a new version, we also take a little bit of time to kind of upskill our users and kind of reorient and kind of motivate them to continue to use it. I want to change a little bit and talk about the role design plays in terms of sustainability of these systems. And I want to go back to you, Poppy, because again, like the upscale system caters to a lot of different data points, or collects a lot of different data points. But I also know Malaria Consortium works in other geographies and also uses other kinds of tools. So not just for ICCM, but also for campaign management. So in terms of design, what role do you think design plays into sustainability and vis-a-vis the user adoption that Maganizo just talked about, which is that if the design is not what someone would find conducive, then there's a tendency to pull back and not use the system. So is this something which you have faced as well? And if you think there is any correlation between how the user experience of the system is and the sustainability of that system?
Well, yeah, I think I maybe touched on it before, but I think we've all seen a lot of digital health programs fail because of poor design, really at that sort of inception phase before you even start to roll out. So I think right from the very beginning, even from proposal stage, you must design for the long term. Now, as we've discussed, sustainability doesn't happen overnight, it can take up to 10, 15 years. It requires a lot of commitment, ongoing support and supervision from an implementing partner and donor before it really is handed over post-deployment. So I think this is where a lot of implementing partners go wrong, is that the design is poor from the beginning and it will fail. So, for example, again, just bringing it back to the ECHIS in Mozambique, you know, we're in year 4 and our learnings are that we needed to probably consider a local hosting model some time ago, but we are in a position, thankfully, that we can now start to look and deploy that, which is what is one of our priorities next year. Again, it's a Comcare platform. And so we have these ongoing sort of subscription costs, which do prohibit longer term sustainability, because I think it's unfair to expect governments to absorb those costings. So again, it might feel like a slight afterthought, and I think you can modify your intervention, but we're now looking at doing that local hosting model. We're now looking at doing that integration into HMIS. But again, just where we're at the moment in terms of thinking about a digitized campaign tool, we're at very sort of early design thinking sort of phases at the moment. And it's looking at, well, again, what are the national guidelines? What tool, if any, is there an off-the-shelf solution? Do we need to customize in order to meet that sort of national level strategic alignment? Again, can we also consider what is already in that ecosystem digitally that we can leverage from? So we're in this sort of 2 phase where we already have upscale that we could potentially leverage on in Mozambique regarding a campaign solution, but we're also in these new geographies where nothing really yet has been digitized in some of our West Africa seasonal malaria chemo prevention areas that we need to really start to consider. And I think it's that kind of cross-pollination. It's taking the learnings of upscale, which is in its 5th year, and thinking, well, where could we have improved 5 years ago, making sure we're not replicating those similar challenges again in a new environment. So yeah, definitely the design needs to come really from the beginning, from that proposal stage, and just thinking about, you know, what also are the kind of drivers of the design. Now, things like, you know, hardware costs are hugely expensive. You know, could we think of a design whereby in terms of recruitment of those cadres of health worker, could we recruit who already own an Android device, for example? So it's not just the platform design, it's also just the entire operational design around it. So yeah, thinking about those kind of criteria, thinking about, could we deploy remote training modules rather than this really expensive, heavy face-to-face training that a lot of us have to fund? So I think there's ways in which, yeah, we can modify.
Those are some great ideas, and I think specifically around like remote training is something which with the pandemic, I think almost every one of us have faced that as a challenge, and the cost involved and safety and again like operational design that you mentioned.
I think just one other point that I'm currently encountering again in terms of the design is this concept around airtime and the data, which drives most of our platforms. Now that we must engage with that private sector and those telecoms providers very early on. I've encountered a lot of problems kind of midway through, tariffs changing, CSR policies adjusting. So we need to think about the design also from the requirements of the data itself in order to capture that data at the community level. And I think that is not emphasized enough when thinking about the design and those types of partnership engagement.
Yeah, that's a great point. Lakshmi, I would want to bring you share at this. Are there any best practices? There are a lot of things that Poppy mentioned, which she talked about experiences from upscale and something which taking to new geographies. But in your experience, are there any best practices that have worked out for you or your partner organization in terms of maybe some of the challenges that Poppy talked about, like let's say airtime, but also generally, like I know when we were chatting about this panel, you mentioned about leveraging Department of IT for capacity related challenges. So can you elaborate maybe a little bit more on the best practices that have worked for you?
Sure, I do. I agree with everything that Poppy mentioned. And I think like one important thing that we've learned or become better at is thinking about these sustainability questions at the beginning, which is what I think Poppy was mentioning, as well as like thinking about what happens when this system scales, and whether this system is scalable or sustainable from the beginning itself. And that means, like you said, involving, even if it's a malaria specific system that we're working on, involving broader stakeholders like the Department of Information Systems, if that's relevant in that country context, because typically they will be the ones who will take on the management and maintenance of a system as it scales up. Or thinking about airtime. And I do feel like it depends country to country how airtime is managed and what the ministry's preference is or how much it costs and things like that. So while we have lessons that we've shared across countries, I don't think we have a singular approach that we've used for that or for hardware procurement and device management. But I think we do have somewhat of a checklist of things that we run through before getting too deep into selecting technologies or implementing technologies, etc., to make sure that it's being set up in a way, both from a governance perspective as well as from the tech perspective, in a way that would be eventually scalable and sustainable, even if the initial objectives are more of a pilot or more of a limited scale. So I think that would be the overarching, I think, lesson learned from us, and it sounds like for others as well.
Right. I see there is one question, so maybe we can take that question before moving on. I'll read that question and maybe any one of you can answer. So in terms of financing, perhaps the private sector is key to sustainability unless the definition of sustainable is long-term donor or government funding or a mix. Can any of the panelists address their definition of sustainability? Very good question, actually. So will Lakshmi, Poppy, or Maganizo, with either of you would be willing to take that as how you define what is sustainability in your program?
I think that's a very interesting question. Maybe I can take a go at it first, since I will be dropping off in 5 minutes or so. I think it's difficult to say that private sector is, and I'm not sure if the question was phrased that way, but private sector is like the main insurer or guardian of sustainability, especially when it comes to public healthcare provision, right? So from our perspective, we view the financial side of sustainability as making sure that the ongoing costs of the system are included in government budgets. Those government budgets may, in some countries, particularly when it comes to malaria, be funded, say, by the Global Fund or other donors, but that it be a long-term source of funding rather than a limited grant-specific funding. So the first priority for us is to make sure that it makes its way into a Ministry of Health budget, the costs of sustaining the technology, and then the ministry funds it either through their own funding or however they fund their broader health programming in some sense. So that's our current approach to the financial sustainability aspects, at least.
Yeah, I agree. And again, I think, you know, that is that's a long-term sort of ambition, which we know, you know, is challenging. It can be piecemeal, like even something like the government taking ownership and funding a mobile phone device management and monitoring system or maintenance and repair is a huge effort. I think operationally for me, how I would define sustainability is, again, using a global good tool that has open coding, that a ministry themselves, dedicated individuals who have been given the capacity building, can configure the platform independently of new enhancements or adjustments without having to depend on really expensive tech companies to do that for them. Again, the sustainability of data, the ministry owning their own data, managing the data flow, looking at the analytics, again, not being on a third-party server, it's hosted within country, so there's that real data sovereignty that's being driven. So I think operationally, yeah, those two. And again, potentially still being funded for airtime and data, but in terms of the actual platform configuration, they have autonomy over that. And actually, that is kind of what is happening right now in Uganda, where we have a project in Bwikwe district, the government really from the beginning have wanted that data ownership. It's sitting within their server. They've already been trained on how to configure the community health toolkit with Medic Mobile. So there has been some good practices there, but yeah, that's what it means for me.
Thank you. I would want to ask the same question to maybe Maganizo as well, but in a slightly different way. So Maganizo, financial sustainability has come up quite often in today's discussion. And I know in OnSafe project and in choosing a BI tool, licensing cost was one thing, which is a recurring cost, but is one thing that was taken into account while deciding which platform we want for data visualization. So when we think of government and how they conceptualize and create systems that are sustainable with specifically these recurring cost of airtime or maintenance cost of mobile infrastructure and so on. What has your experience been with the Ministry of Health in Malawi, and how you handle such challenges there?
Thank you, Savresh. So yes, I think the financial component is key for sustainability. I think, as it has been mentioned, there are small things like subscription, monthly subscription, even $20 or $50 a month. Airtime, even 2 GB data bundle. But as long as these are routine and you have to do them maybe every month or every other period, I think they become a bottleneck in the implementation of the systems. But I think there are workarounds that I think now governments are trying to do, and maybe we are trying to do in Malawi. I have heard the colleagues from Mozambique on the focus for local hosting. So you notice that it is a lot of infrastructure for you to do local hosting, but in the end, it allows you to run and manage the systems without, of course, there are other bills to meet, but sometimes those bills, they are not obligatory at a certain point of time, to the extent that you might lose a service, like maybe being cut off and the like. So I think that's one thing. There are other solutions that we are coming up with, like we have attempted, maybe it's there in other countries, but we are doing like the health system, working with our e-government department. We are relying on them to set up the connectivity to the facilities and the like, but also through harmonization, getting other donor support into the same channels so that we can reach more to more facilities with the connectivities. Of late, we have gone on reverse billing. So actually, we are putting all the systems that health workers are using into that, and then coordinating with partners so that the end users can access the systems, only the systems. Like if they need to upload data, they can do that. If they want other internet services, it means they can use their own data bundles and the like. But we are trying to harmonize that so that maybe if the donors today, since most of our funding is through donors, if they change focus, maybe we can get others who can support, but with government coordinating these things. And I think this is one of the key issues as well. Most of the things, they are easier if government is in front, not cutting off the participation of implementing partners and the like, but if the systems are seen to be owned by government, issues like data bundles, it is easier to approach other donors to also participate in the investment in that way, because then they see it as supporting the government not supporting fellow implementing partners. So I think these are some of the ways that we think or have been experiencing in terms of addressing issues of financing. But also I think a good point which came up, making sure that government also includes in the budget some costs towards these investments. It's a gradual process, but at least making sure that every year there's an increment or an amount allocated so that the investments can be maintained. So I think these are some of the areas for financial sustainability.
Thank you, Maganizo. Maybe now we can open the floor for questions from the audience. If there are any questions, please feel free to post them and then we can take them one by one. I see there is a comment where Jocelyn has said that she agrees with you, Maganizo, that the government should take the ownership and leverage to get subsidized on or bring in even free services. So if there are any questions, as I said, like please let us know. Otherwise, I have yeah, Maganizo, please go ahead.
So I wanted to also okay. So since I think you gave me a different alignment on the issue about the private sector and the sustainability. So I think there's room for the private sector to participate. I think we call it public-private partnership, but I think also to look at the business models. I haven't seen good ones so far, because I think on the one hand, like in Malawi, health services are free. Of course, we have health insurances and the like, but in general, public health services are free. So it means when you are bringing in a a private participation, that also should be taken into account. So I think it's an issue of looking at the models, like what models can we adopt that can facilitate that? Because indeed, the private sector can support and maybe help to address some of the issues that we have. Thank you.
Absolutely, and there is that one, as you said, but for airtime. So this reminds me, actually, in India, we were doing a project for the nutrition, and the recurring challenge of airtime, the way government handled it there was by partnering with a private sector organization, which was giving it at a reduced cost because of the scale of the project, but also something which was handled automatically. There was no single person who was supposed to manage all of it. It was seamless in that sense. So there was a partnership, but also like costs were also taken care of through that partnership. So that's true. Yeah.
I think one thing that we're sort of encountering in Mozambique is this potential that, that ownership model of digitization of programs can potentially be fragmented between a community health division and an NMCP, for example. So, there's discussions around introducing a new campaign tool that would most likely sit under the NMCP division. And so I think, again, it's the expectation that we do need to streamline these investments. And again, when I talked about where do they get housed, once they graduate from pilot, where do they sit? Now, they may sit in two different divisions, therefore there could potentially be this conflict around whose budget is paying for what. So I think they're in a crowded partner market. That's where this governance must be led by the government and those different divisions that those programs and platforms may well sit under. And that's also, it's not just the partner coordination, it really is also at the ministry national level as well. So when, just considering around the budgets, that is often a reality of that fragmentation of where is it sitting and who's paying for what. And that's really critical. And that's why, again, this sort of standardization is really important, you know, and how can you leverage on that ecosystem that already exists? So, for example, we have an ICCM tool. If we're introducing a campaign tool, then we already have 3,500 pieces of hardware distributed across Mozambique. Could we not, again, merge together a campaign tool with a routine public health activity? So, and we need that strategic leadership from the ministry to prevent this proliferation of digital pilots that can potentially jeopardize some really good strategic thinking.
Agreed. And I think one thing which we didn't get a chance to talk about is when we bring in these different tools, how complicated the data analysis becomes. So that directly doesn't relate to the sustainability part, but it does relate to, we are bringing in a lot of these digital tools to actually leverage that data for decision making, for better programmatic outcomes. And as soon as we have 5 or 6 or 3 different tools, the cross-functional analysis becomes very, very difficult. So we might be catering to the same set of population, but then campaign tool will have its own kind of data set, data model, and then other tools will have. So that's a very key question as well. If there are no questions, then I think we are almost at time. We can definitely take one more questions if there are any. Otherwise, we can wrap up. Maybe give 30 seconds more to audience if they have any questions. All right. So there is a question, if the tools are limited, how does innovation happen? Which, I don't know, Poppy, would you be willing to?
And it depends what you mean by limitation. I mean, I think this is where tools can transpire. And this is, again, where your sort of partnership with your software, you know, like for us at MC, we're working really closely with Demagi and we're trying to build out, for example, potentially what is a routine digitized tool can also pivot into being this more dynamic tool that can also address campaign requirements. So again, I think it's working really closely together to see if you can enhance and elaborate on what you already have. So yeah, I don't think there has to be limitations. I think this is where we all have to get creative and a bit more agile in terms of what is already out there and how it can be leveraged on or redesigned to meet the requirements.
So I think quickly, Savish, I think that there has to be a balance between the innovation and also sustainability. I think in an ideal environment, the government will put the standards and all the tools should conform to those standards. But if we want the government to take over those tools and to own them, maybe it might be too much to expect the government to get 20 tools with the under-resourcing and the issues of resources that we have talked about. So I think at a certain point, I think there has to be that reasonable consideration in terms of with the standards. How many tools can we allow for both government and the partners to implement that we expect the government to own any other day? So I think that's also a significant consideration area to consider. Thank you.
Agreed. And on that note, I want to thank you all for joining. Thank you to all the panelists who were able to share their experiences and some of the great questions coming from the audience. It has been very insightful discussion personally for me. I'm hoping we can continue the discussion to design and deploy such ICT4D system which are sustainable and exist for long term. Thank you, everyone. One last thing, please fill out the session. As soon as this panel ends, there will be a survey which will be sent to you, one question. So please fill out the session if you have time. Goodbye, everyone. Take care.
Thank you.
Thanks, everyone. Bye.